transesophageal echocardiography.
What is TEE? It is a specialized type of cardiac ultrasound which allows real-time imaging of the heart and its blood vessels. The test can be used for adults and children. TEE can diagnose heart or blood vessel diseases or conditions. TEE provides information about the size and location of the heart and how well the heart chambers and vessels are working. Why TEE? TEE is used for multiple reasons such as infective endocarditis, diseases of the aorta, intracardiac masses, evaluation of valvular regurg, technically difficult transthoracic exam, and assess a patient's status during surgery. Risk of TEE procedures, they have very low risk and complications. The most common complication after a TEE is a sore throat, but that does go away after a couple hours. Other complications can include anaphylaxis, arrhythmias, asthma attack, heart failure, hypertension, or hypotension. You need to prep before having a TEE done, so the patient should fast 4 to 6 hours prior to the exam. No smoking after midnight before the procedure. Make sure the patient removes their dentures, consent form is signed, and make driving arrangements for after the procedure.
How a TEE is performed. Most often it's done in a hospital. Anesthetics will be sprayed in the patient's throat and be numbed. The patient will then asked to lie on their left side. The patient will be hooked up to an EKG machine. A small flexible probe will then be placed down their throat, and the tech will ask the patient to swallow the probe. And this is the most uncomfortable part. The tech will begin taking images by moving the probe around. After the TEE procedure is performed, the tech will check the probe for evidence of bleeding, check the patient's mouth, monitor vital signs for 20 to 30 minutes. The patient should remain NPO until gas reflex returns, which is usually between an hour or two. Driving arrangements should be made, and check the probe for cracks, tears, and clean after each patient. The probe. A Philips Micro TEE probe. It has a 32-element phase array, 6 megahertz, 3.2 to 7.4 megahertz. A 2D color, pulse, and continuous wave Doppler, 7.5 millimeters in width. The probe has 2 knobs that flex the tips anterior, posterior, and lateral. The 3 main types of TEE probes are monoplane, biplane,